last year I sustained an injury that sliced some tendons in my finger. I have health insurance, and through the health insurance, I found that my health care actually rationed my coverage. I was limited with therapy prescribed by doctors to $9 a year. Total cost to me was $16,000 out of pocket. The concern I have is that in America, with a GDP spent on healthcare that we have, the results we don't receive, I don't understand why we don't look at this similar to as the Taiwanese people did. The Taiwanese felt it a moral obligation that everyone be covered. I understand there are 35 to 40 million uncovered people. As you said, ER is not the place to take care of people. The doctors, we need to look at a system that helps give incentives to young doctors to go towards primary care, to help cover everyone so that we don't get as sick and stay healthier as a nation. I feel that, you know, this whole bashing of government-run healthcare is ridiculous when we ourselves have one, Medicare, a government-run program that was developed by LBJ based on the Canadian Medicare system, also the same name. Why is it that we have so much opposition towards this, Mr. Grassley?
Well, I'll be glad to answer your question. Part of it is how we're trying in a different way other than putting people in Medicare or a Canadian-style system is how the ideas about doing that. And then secondly, I would suggest why not Medicare? First of all, and I'm not saying that every one of these things I'm going to say is going to answer every problem you brought up. But for instance, with you having private health insurance and the fact that you had out of pocket or something wasn't covered, a lot of policies have limits, outer limits, like maybe it's even $1 million, but whatever it is. Our plan is to not have those insurance plans have those limits. Also, denial of care, or no, denial of insurance because of pre-existing conditions. We would do away with that. And then you've got very low premiums in a state and very high premiums in a state. We would we wouldn't have one premium like Maine has, because that probably hasn't turned out to be a very good thing there. But we would narrow pretty much so there's not a wide spread between the low premium and the high premium. And this is unrelated to what you say, but it's part of what we're trying to do to reform private health insurance, to give some credit through premiums for people that have healthy lifestyle. In other words, so if you don't smoke, you aren't paying for somebody that does smoke. Or if you exercise and eat right, and you aren't paying for somebody that doesn't, because this lifestyle has a lot to do with health, and we want to encourage a healthy lifestyle, or at least economic encouragement of it. Okay, then actually what I just said is the hardest part of explaining. The part that you ask about Medicare, if you would talk to hospital people here, doctor people here in your county, you'd find out that Medicare pays about 80% of costs. And so the federal government's not paying what it should pay. But that's another thing that's wrong with getting government more involved in health care. If the government can regulate, and it can regulate, and in the end then you get some rationing. Now, I'm not saying that there's much rationing with Medicare because people can have to have co-pays and can get supplemental insurance. But if you look at your local hospital telling you that, well, they have a hard time operating because they have so many Medicare people, and Medicare doesn't pay 100%, and then you're asking me about putting more people on Medicare, and the House bill for sure says this. I don't know about the Senate bill exactly, but the House bill says, well, if we put people into a government-run plan, which is part of their bill, and which is something that I've been working against because I think it has these sort of negative things that I'm telling you about. If you, they're saying you can't pay more than Medicare rates. Well, then if you put 35 or 40 million people more into Medicare, and they aren't only going to pay 80%, and that's what the House bill says, then you're compounding the problems for O'Brien County Hospital or wherever your hospital is.
But we currently have rationing with our healthcare system. American Family Insurance told me that they couldn't give me those different therapies required, and the health insurance is looking at a bottom line towards stockholders. The government does need to pay the difference in Medicare. We need to compensate our doctors correctly. The hospital should be covered so that everyone can get access, but it's not with the current system, and health insurance is looking at stockholders, not people. And that's what we need to have our representatives do, is look at the better solution for people, giving us the health care we demand, because it's not a free market choice. We don't choose which ambulance is the cheapest or hospital is the cheapest. It's you. This is where you have to go, and that's where we need you to say this is what's for the people and demand it for us.
I could comment one thing further about our private health insurance reform, that to react to what you say, well, the free market's not working. The whole effort is to get more competition, and even in these bills that I've described, and maybe if we have a bill, it would be in our bill. We want to set up exchanges in each state that can be entered by you with through computer or 800 number, where every plan in the United States, and also in conjunction with this, we'd have to do away with a law that doesn't allow health insurance to be sold across state lines, because that reduces competition. And so you can go to a computer consumer-friendly place to look at every plan in the country and every price, so that you can get better insurance than maybe what you got right now.